Hello, I'm so glad you joined us for another episode of Health Hope. My name is Joan Warner and I'm your host. Health Hope is a show designed to help you mentally, physically, and spiritually. God created us. He made these marvelous bodies of ours. Health Hope will give you new insights into healthy living and lifestyle changes. Now I want to welcome our special guest, Dr. Ervin Davis. Welcome, Dr. Davis.
Thank you, Joan.
So glad to have you.
Glad I'm here.
I understand you're a writer and you've written a book called Vaccine Alternatives.
Yes, I have.
Could you give us your credentials?
Well, I am a physician by training, but I do a few other things too. My goal is, or my lifestyle, or my research has been in, my training has been in research in several departments, pharmacology, anesthesiology, pediatric urology, surgery. So these are departments in research. So I am a researcher.
Right.
So that's a little bit of what I do. And I have in the past worked at Wildwood. It's a lifestyle center in North Georgia. I've assisted and worked with meat ministry as well as a UT Pines and with Dr. Thrash.
Well, you have some very good credentials. That's very impressive.
Well, the Lord has blessed.
Yes, He has. Okay, so the average child has many vaccines by the time they're 6 years old. How many vaccines does the average child get by the time they're 6?
The average child get 49 vaccines before they enter first grade. So by 6 years old, that's how many they get. And I think I can remember well that I would stand in line to take that little sugar cube that they would give us. You remember that? We got a little sugar cube. So compared to what we got, I mean, it's off the scale. It's over 300 times. We got about 3 to 5, and now they get 49. And so we're asking with all of the vaccines, whether the live virus or a dead virus, whichever kind it is, do they bring on other problems? And I challenge all of my listeners or reading, or those who read the book, to actually compare and make their decision. And I believe in that parents or guardians should be free to do what they determine is best for their children.
If you don't get a vaccine, what kind of precautions should you take?
Lifestyle is the key. If we are eating and drinking and getting the rest we need and not being stressed, our lives are in order, then the body is able to fight most of these infections that are so rampant in the world. We have many viruses and we have many bacteria. Some are serious. There are ways of treating viruses and bacteria that we could use some of the simple natural remedies for that. I would say that if there is a virus, then we need to be diagnosed, and the treatment should be specific and pointed. And we can talk about some of the herbal agents that are good for that, but what we're looking at holistically is what does it take to strengthen the immune system so the immune system can do its job.
Right.
And that means good nutrition, it means exercise, plenty of water, inside and out, sunshine. Sunshine kills bacteria and viruses. In certain foods, we know that they're helpful. So we're advocating in this process that we should live a wholesome lifestyle so that the body can do its work. Now, Joan, I know this is a big controversy worldwide.
It sure is.
There are Nobel laureates on each side of the issue. So I'm probably not going to solve this or convince many, but I would encourage and challenge anyone to look at the science and make your decision based upon your belief system as well as the science and see.
And what kind of complications could possibly arise from having 49 vaccinations by the time you're 6?
Well, a lot of those vaccines can actually trigger autoimmune diseases, where the body actually begins to fight itself. This is in the literature. This is the way we studied. When I was in medical school, I studied the immune system, quite interested in the immune system and how it operates, how it works, how it remembers, you know, these exposures. And so I know a little bit about the immune system, but we need to make sure we're holistic in our approach. Sometime when we give a vaccine, it does not engage the whole system. I don't think it's the best policy to actually inject a vaccine into somebody's body. If we encounter a vaccine, we do it through breathing. We can do it by touching or the skin, and by that method we engage the whole system. But if we're going to actually inject someone in, then we're bypassing the tears, we're bypassing the other agents or elements of the body that prevent a disease before it gets into the system. We're bypassing that, and so I think there's a concern for that.
All right. If you're a worldwide traveler and you want to go into other countries as you have, don't they expect you to have and demand that you have vaccinations?
That's a two-sided question. I have traveled worldwide since 1973. I took my last vaccine or a shot in 1973. And that was when I was in the military. I had no choice then. They said, you know, you need to take this. And not understanding the whole process, I did. But since then, I've traveled worldwide. Now, the major one that most third world countries ask for, including Africa and Asia, is the yellow fever vaccine. And so we've had medical missionaries to go to many of these countries. And what we do is I often will actually write a letter to the ambassador here in Washington and explain my trip and why I'm going and the reason I'm going, and say, well, you know, I don't take medical vaccines, but I do immunize myself against disease. And so then I will look at on the CIA's website and see the epidemics in that particular region, and I start before I go to taking some of the preventive measures to prevent, you know, eating more garlic. And we know that with lots of garlic, we don't encounter the mosquitoes because they don't like the garlic, so they don't bite. That's just one little. And then we use some of the other herbal agents that actually prevent these, and so we're making sure that we're doing the right thing. We're getting proper rest, and we're getting the foods that will strengthen the immune system and let it do its job. So no, I have not taken any vaccine since 1973, and I travel worldwide.
And you've been in about how many countries since then?
Oh, probably 30.
Oh, mercy.
At least 30.
You look pretty healthy to me.
Well, praise the Lord. I know, you know, we are looking at some of we just had an Ebola scare a few months ago. We're looking at some of the preventive methods, herbal agents that can be used for the Ebola. That's a serious one. Mm-hmm. I went to Malawi, I think, 3 years ago, and when I was in the country, someone told them that I was there, and so they came and got me from the medical school and said, you know, most of our residents, or when they graduate, they have to go back out to their rural areas. Could you give us some instruction? And I thought I was going to be there for about an hour. I was there for 2 days. And that particular school, because a lot of the countries will not take the antivirals for HIV, and that's what they wanted to know about. HIV is a virus. And so antibiotics don't fight viruses.
Right.
And so we, looking at the research, and we looked at these herbal agents that are antiviral. And so just prior to my going, I had put together a PowerPoint presentation for the assistant to the secretary of the public health department there. And so she was in Chattanooga. I did the presentation. But what we did is we selected all the antiviral herbal agents. We're talking about pomegranate.
Pomegranate, really?
Is antiviral. We're talking about blueberries. We're talking about licorice. We're talking about all the mint-flavored herbal agents.
Mint flavored.
Mint flavor. So mint-flavored herbal agents, mostly, oregano, basil, they are actually antiviral. And so we put this list together, and the medical school decided to plant these herbal agents so they can give to the citizens of Malawi. Now here's the problem. A lot of in some of the third world countries, they will not take the antivirals, because as soon as they take the virus, the antivirals, they begin to become emaciated, and everyone will know that they have the disease, and so they don't take them. But they will take the antivirals. Now with lifestyle changes, now you got to have lifestyle changes, and so viruses, can be treated, but if we're not adjusting the lifestyle to match, then we may not get the greatest advantage.
Right.
But these are a few methods, and that's one country that we assisted in providing the antiviral herbal agents. And then we can also include, because whenever a person gets HIV, they often get many bacterial infections as well. So we will blend these herbal agents along with the antivirals to make a difference. And we're talking about third world conditions, so those heart drugs, and this is what they call them. There are 5 heart drugs, H-A-R-T, heart, and they attack the HIV virus in 5 locations. So our goal was to find the herbal agents that would actually attack that virus in the same 5 locations that the drugs did it. And so there are many herbal.
So they're working synergistically.
Yes, we get a range of them, so they work synergistically in order to help.
They're more potent because you have many herbs combined.
Yes, we like to put about 3 together, 3 antiviral herbal agents together, and per dose. And then we can rotate that during the course of a week. Let's say if we had 10 or 15 herbal agents that are antiviral, then we would rotate around that list. And there are many.
Is there a reason you rotate around the list?
Oh yeah, so the immune system won't get accustomed to one.
Again, I have with us Dr. Ervin Davis, and we're discussing his book, Vaccination Alternatives. So we were discussing about children and vaccinations, and it is mandatory. So how do you get around that if you choose to do the alternative versus the vaccine?
Most states, all the states, will give waivers. Going to your library and determining what your state will give. There are 3 types of waivers, and this is in my book, and it gives those states 3 types of waiver. You can get the medical waiver, you can get the philosophical waiver, and you can get the religious waiver. And so what we do is we tell the parents to find out and decide which they want to do, and then they could waiver out of the one that they feel. Many parents are beginning to take a second look at that. It does not make much sense, and this is why the parents are looking. It does not make much sense to give a child, a 2-year-old, a 3-year-old, 5 vaccines of 5 viruses at the same time. And so some parents have opted for just one. So that's one way you can waiver out. You can talk to your healthcare provider and let them know what you're doing, the kind of life you're leading. That's important. If you're taking your child to some of the daycares, kids touch, many things. And you're taking your child to the mall every day, then those are possibilities of getting some of these, airborne viruses or bacteria. So making sure that we get sunshine, fresh air, the food is proper, and their immune system, sometimes it's good. I know growing up on a farm, I was exposed to a lot of things. And I didn't get sick because, the biome, now they're doing some research on the biome, the human biome, and seeing what we come in contact with. That's a very interesting study in itself. But doing what we can do, because again, at 5 years old, 6 years old, we get 3 shots, and today we get 49. And we began to say, what is there a limit? Why are there so many infections? Well, it's because of lifestyle. By eating certain foods, sugars, a lot of sweets and other things, we actually weaken our immune system. And so and not being exposed to some of these bacteria, and we get it tends to be worse. So waiver is one approach that we encourage parents to do if they are opposed. And then, of course, there are a few herbal agents, and staying in touch with their healthcare provider, the pediatrician, so that parents know what they're dealing with and they can make decisions appropriate to that. Now, my approach to this is, I believe parents ought to be able to make decisions for their children when they're not able to do so. Right. So parents should have a say in this. Right now, our Constitution gives parents that ability to make those decisions. And I wouldn't want to take that out of the hands of the parents who know and say, giving it to someone who does not know the child, does not know the lifestyle, and based upon the knowledge that we've received. My opinion in the past was to practice and do as I was taught in medical school. But after I received a call from a lady, she said that I don't know what happened, but my child became autistic at 18 months old. And so it encouraged me to I did about a 3-year research on vaccines.
Right.
And after that study, I had to change my view because I think by just giving a vaccine with the adjuvants in it may be worse than the disease process itself, because you're actually concocting a drug. You're concocting something and you're injecting it directly into the immune system along with the virus. And so eliminating some of those potential toxins is a serious issue. I won't go into great detail. I'll let you read the book and and see what my thoughts are. But this book is different than most. It says, I try to avoid saying, well, don't do this, don't do that. My approach is to provide the information and give you more. What can you do? Okay, and so this is why the book is different. So for those who travel, including healthcare workers, we try to encourage them.
Flight attendants?
Yes,
pilots.
yes, they may encounter. And this is why a healthy lifestyle, getting plenty of sleep so the immune system can do its job.
That is very interesting. Now let's discuss influenza.
Okay, so we are talking about the flu.
Right. How's it made? How's the vaccine made?
Same approach. There is a recipe, And with any vaccine, you have to grow the virus. You have to synthesize it or get it, give it a medium that it will grow on so that you can get much of the virus. And what they do is oftentimes they'll give a person the virus itself. You can use a live virus. You can use a dead virus. Well, I don't really like any kind of virus floating around in my body. Not any kind. And
because
so,
they don't ever die. So they grow their own viruses for the vaccination. What else do they put in this vaccination?
They put a lot of antibiotics. Lots of antibiotics. They may put, some of them they include aluminum gel. Aluminum gel they would include. They have to give it some kind of medium for it to grow on. And that medium can be a host of things. It could be monkey kidneys.
Monkey kidneys.
That's some of the ones that they use there in Africa.
Okay.
They can use chicken eggs. And so that's why they always tell families that if your child is allergic to eggs or chickens, don't give them this particular virus because that's the medium in which it grows. And then they give another ingredient, a part of the recipe is they call it a diploid cell.
Okay.
Diploid means it's a human cell, so it could come from aborted fetuses. So these are part of that recipe. Now this is the research. So what I'm saying, I know it may seem far-fetched to many, but you do the research. You decide where you are on this continuum, this spectrum here. So my philosophy is give everyone the ability to make their own decisions about what they take. I've noticed that they target, two groups are targeted with vaccines. Can you guess what two groups are?
What are they?
The two groups who are targeted are the senior citizens and babies, children.
The most vulnerable groups.
Exactly. And so I think that we need to rethink. Now again, I've been trained as a physician, so I believe with all of my heart that we should be diagnosed. We should know what we're up against. But I think when it comes to treatment, with all the side effects of drugs, which is safer? Sometimes the medication that we receive is actually worse than the disease we have. So I think we have to balance this, and with our healthcare providers. I don't want to eliminate the healthcare provider.
Right.
We want to be in a corporate and mutual agreement on this. So we have to, as clients, we have to really work this together.
Okay.
You know, the knowledge and understanding that our healthcare providers have, we want to utilize that. But we also want them to consider our needs and our perspective as well. Okay. So that's the way I relate to my patients.
I understand. All right, we have a couple more minutes. Let's discuss HPV.
Yes, yes. Well, HPV is one of the newer viruses or vaccines that they're giving. It was just added to the list of 49, so we have about 50 now. And as you know, it was designed for basically young girls. They're talking about establishing one for men as well, little boys, because the sexual rate or activity has lowered. And that's another issue, but that's who it's designed for. And mostly those who take the HPV, this is the human papillomavirus. Most of those who take it are little girls between the 11 and 13 year range. Now the thing is that they have to take a booster after a couple of years because it's no longer effective.
Oh, really?
Oh yes, it doesn't last forever. And so by this, my thoughts is that why would we give an 11-year-old the human papilloma virus vaccine? Why would we? They should not be sexually active at that age. And even if they are, and this is a virus that causes cancer, and so making sure that we're targeting this in the right place, and that's my perspective.
Right.
Now, we know that the virus itself, there are 127 viruses that can cause HPV or cancer of the system. 127. Now, the particular vaccine only deals with 4.
Oh, only 4?
Only 4. So, and 2 of those are genital warts, not the cancer itself. And so what about the other 123 viruses that can cause this? So I think our research should be a little greater than what it is. Now, let me explain. I worked as a researcher in the pharmacology department at the University of Massachusetts, and I worked in anesthesia. And so I am a researcher, and whenever I get something intriguing, I want to know. And so I think as we're doing in our lifestyle centers, the one we construct and establish, we want to give the science, we want to give every aspect. We don't want people going off being ignorant about what is causing disease. So this is one of the areas that we encourage knowledge. Knowledge, in many ways, is freedom.
And power.
And power, right. Yes.
Well, all this is very fascinating, and it's covered all in your book, and I like that. I like the awareness factors of that.
We want to make people aware.
Well, I've enjoyed your stay here. I hope you come back.
I've enjoyed it. I'm willing to come back, yes.
For more information, there is a website, and that website is what?
www.healthylifestylechoices.net. That's the organization.
Okay, one more time. What is that?
www.healthylifestylechoices.net.
Thank you so much.
Gladly.
And thank you for allowing us into your home. We hope you come back. Bye now.